So axial streaming has been my obsession in the last few months because this is a fascinating concept. And it's influenced by our CVR, catheter-to-vein ratio, flush, or KVO. Axial streaming, has anybody heard of this? Axial streaming? I don't even think your vascular surgeons would actually know this if you asked them. If the speed at which the blood is flowing will congregate the more dense materials of your blood. Your clotting factors, your RBCs, your platelets, hormones. And then the outer layer of that flow is populated with less dense material like plasma, water. So the axial streaming, the fluid dynamics itself, is protecting that lining of the vein, not allowing clotting factors to just hit that wall very easily. And then when it moves too slowly, it starts to what's called margination and pavementing. So when it doesn't move fast enough, those proteins and those heavy materials start to move and touch the walls. What condition exemplifies this? Which one? Sepsis. Sepsis? Ooh, I don't know. Let me think about that. Afib. Doesn't Afib slow down the flow of blood? Doesn't cardiomyopathy? Doesn't valvular insufficiency? This is the root reason why these patients have these thrombotic events. And that glycocalyx erosion explains why diabetes have bad veins and they clot more easily. Okay? So that's why I encourage you guys to kind of take that PowerPoint and look a little bit deeper, all right? So I'm gonna skip that diagram. Catheter-to-vein ratio matters. In the ER, we used to tout bigger is better. Put in the biggest vein, yeah, 18 gauge of the pinky. That's awesome, you're great. No, you're stupid. This is why. When we put in the larger catheter, unnecessarily, if they need it, the treatment comes first. But if they don't need it, why the hell did you put that 18 in that pinky? If you want it to last, you need to put in the smallest possible catheter for the most appropriate treatment. All right, so just keep that in mind. This is what's happening. That's why the bigger catheters are clotting and failing. I'm going to skip this KVO because I don't think a lot of us deal with KVO, but just know that KVO can also interrupt that axial stream. It's so theoretical, I don't want to go too deep into it right now because we have a lot to go over, and I'm kind of moving a little slow.